This conference will now be recorded.
Good evening, everyone. Myself, Devjini Roy from Skybook team would like to welcome you all for today's session. Today's webinar on role of micronutrients in immunity is brought to you by the team Skybook. Speaker of today's webinar is Dr.N.Ashok Viswanath. So before starting the webinar, it's a humble request to you all to please keep your audio and video settings off in order to avoid disturbances during the session. Now, I would like to introduce you all to our today's guest speaker. Dr. Ashok has a degree in MBBS, MD, DNB, MNAMS, and has a PG diploma in infectious diseases. He is currently working as an assistant professor in clinical microbiology department and is a consultant clinical microbiologist. Coming to his achievements, Dr. Ashok has achieved distinction in MD degree exam, All India first in DNB degree June 2020 session with a specialty of microbiology, and is also awarded President National Board of Examinations Gold Medal at New Delhi. Sir, I would like to thank you for taking the time out of your busy schedule to join with us for this session. It's an honor and privilege for our team to host such a webinar. Sir, now I request you to take over the session. Over to you, sir. Thank you.
Good evening, everyone. Were you able to hear me?
Yes, sir. Sir, is there any issue? Dear participants, we have to wait for a while for our speaker to join.
हे असं का होतंय? मग मेसेज
Hello, good evening, everyone. Are you able to hear me? Are you able to hear me?
Yes, sir, we can hear you.
Yes, we can hear you.
Yes, sir.
Okay, I'm not able to share my screen. Like, can you allow me to share my screen?
Yes, sir. Please wait a while. So there is a button beside the microphone. You just need to click that button to share the screen.
Yeah, madam. Now I'm able to. Are you able to see my screen?
Yes,
Yes,
sir.
sir.
It's visible now.
Okay, madam. So, a warm evening to everyone. So, I would like to thank the Skybug team and the organizer and the founder, Madam Dr. Devashri Roy, for inviting me for today's session. And I also want to thank all the participants for joining today's session. And so, today's session is all about the role of micronutrients in
Sir, I would like to interrupt. Your voice is not audible.
Were you guys able to see my screen?
No, sir. No, sir.
No. Okay. So now were you able to see?
Yes, sir. Yes, sir.
Okay. So I'll restart. Sorry for the technical glitch, and a warm evening to everyone. So I would like to thank the Skybug team and the organizer founder, Madam Dr. Dabashri Rai, for inviting me for today's session. And I also want to thank the participants for joining today's session. And so today's session is all about the micronutrients and immunity. So can anyone tell like what is a nutrient first of all, and what is a nutrient and what is an immunity? Can anyone tell? So let us have an interactive session. Like, can anyone tell like what is an micronutrient and what is an immunity? Can anyone tell? Guys, were you able to hear me?
Yes, sir.
Yes, okay. Can anyone tell like what is a nutrient and what is an immunity? So there are around 135 participants.
Sir,
So can anyone
immunity
tell?
is defense mechanism, sir. Our
Okay,
body defense
Immunity,
mechanism against
okay,
pathogens.
Immunity, yeah, sir. Immunity
okay,
is the resistant power exhibited by the host towards the
okay.
any infection or disease.
Very good. So here, like we are going to see about an overall thing about a nutrition, and when we are going to study about a nutrition, so these are the molecule which are provided through the food which we eat. So whenever like we think of food, like moreover like we think about their taste and their appearance, but sometimes like we need to see about their characteristic chemical nature, like which is going to have an effect over our body. So when we are going to study about the nutrition, like we are going to have two type of nutrients. One is going to be the macronutrient and another is going to be the micronutrient. So macronutrients are nothing but the carbohydrate, protein, and the fat. So these are the element which is going to provide our body with the energy source, and these are the molecule which is going to supply the various organ with various function. So these are the macronutrient. So today I'm not going to have a touch over the macronutrient, so I am going to talk about the micronutrient. So when we are going to talk about micronutrient, so these are nothing but the vitamin and mineral. So they are going to prevent various diseases and various deficiency disorder. So this is about the nutrition. So we are going to see about the role of micronutrients in immunity. So now we saw what is a nutrient, and we will see what is an immunity. Okay, so like now we are moving on to the immunity. So immunity is nothing but our body's defense mechanism against various infections and various malignancies like cancer, so which are mediated by our immune cells. So there are various immune cell in our system, and those immune cells are going to contribute, and they are going to act against the various infection and various forms of malignancy. So here like we are going to have our stem cell from which our granulocyte and the lymphocyte is going to arise. And the example of granulocyte, like like it's going to be like cells like neutrophil, eosinophil, and basophil. So the classical action against which the particular neutrophil is going to act is going to be the bacterium. In case if it is going to be the eosinophil, they are going to act against parasite like plasmodium or any nematode or any parasitic etiology. The particular eosinophil is going to act. And there are some cells called non-granulocyte. So these are the WBC which doesn't have any granulocyte. Example is going to be our T lymphocyte and B lymphocyte. So were you guys able to understand like what is a nutrient and what is an immunity?
Yes, sir.
Okay, so like with this, like we will go into the type of micronutrients and immunity. So when we talk about micronutrient, like we know it is going to be the vitamin and the mineral. So these are the molecule which is going to prevent the various forms of disease and various forms of deficiency disorder. Okay, so that is about the micronutrient. So here, like we are going to focus on the vitamin and the mineral. So whenever like we are going to talk about a vitamin, like it is like converted into a fat soluble vitamin and water soluble. So these are the two forms of vitamin like which
Yes.
is available, and there is going to be
Yes,
something called
sir.
as minerals. Yes.
Yes, sir.
Okay, so like we will go into the fat soluble vitamin first. So fat soluble vitamin, the classical example is going to be our vitamin A. Example is going to be the retinoid. So these are the three.
ADK.
Yes.
Vitamin A, D, K. That's all
Okay,
the
so vitamin.
vitamins.
Okay, so vitamin A. Okay, we will see one by one. So vitamin A, it's going to be the retinoid. So it is going to enhance immune signaling, enhance class switchover, and vascular monocyte and to tissue macrophage conversion. So I'll let you know one by one. So enhance immune signaling. So whenever there is going to be an infection inside our body or any autoimmune disorder or any formation of any malignant cell, there is going to be an interaction between the host cell and the WBC. So what is going to happen is that there is going to be the immune signaling mechanism. So immune signaling mechanism is the mechanism by which our host cell is going to indicate the abnormality which is produced in our body. It can be any kind of infection. That infection could be due to the parasitic etiology, or it could be due to etiology like any viral etiology or any bacterial etiology. So those particular etiology, when it comes in contact with our host cell, the host cell will give a signal to the immune mechanism. So thereby our immune cell is going to get activated and go and get going to act against a particular thing. It can be cellular mediated immunity or humoral immunity. And the second point is class switchover. So whenever like we are going to get any infection, so there is going to be the formation of antibody. So what is going to happen is that there is going to be the production of antibody. Those antibodies are going to act against the particular antigen. So antigen are nothing but the particular infectious substance, that is the antigen. So whenever like there is going to be an infection, there is going to be formation of two type of antibody. One is going to be the antibody which is going to act immediately, that is going to be the immunoglobulin M, and there are antibody which is going to act at the later stage, which is called as the immunoglobulin G. So immunoglobulin G is going to play a major role in the memory cell. So whenever like we are going to have an infection for the second time with the same pathogen, IgG is going to have a major role, and the immediate antigen is going to be our immunoglobulin M. So whenever like we are going to have an infection for the first time, example like I may be getting an infection like dengue for the first time, so what is going to happen is that after some 4 or 5 days, my WBCs are going to produce some immunoglobulin molecule, and the immunoglobulin molecule is predominantly going to be IgM. So IgM is going to act against this particular pathogen. So that is the immunoglobulin activity against a particular cell. So what is going to happen is that there is something called class switchover. So class switchover in the sense, so the particular antibody which is produced during an infection is not primarily going to be IgM, it is going to be an immunoglobulin molecule, and that immunoglobulin molecule will undergo a class switchover to differentiate into various classes of immunoglobulin like immunoglobulin M or immunoglobulin E or immunoglobulin G. In case if there is going to be anything like a parasitic etiological infection, so what is going to happen is that there is going to be the class switchover of immunoglobulin from immunoglobulin M to immunoglobulin E. So immunoglobulin E is going to act against the pathogen. So there is going to be the class switchover which is specific for that particular parasitic etiology. So that is about the class switchover. And there is going to be the conversion of vascular monocyte to tissue macrophage. Example, so we have our blood system, and in the blood like we have something called as vascular monocyte. So these vascular monocyte, when there is going to be any infection, example there could be any abscess formation in the subcutaneous plane or tissue, what is going to happen is that this particular vascular monocyte is going to get converted into the tissue macrophage. So they are going to enter the tissue and they are going to get converted into the tissue macrophage, and these tissue macrophage are going to go and engulf those organisms which is going to cause the abscess. So that is the vascular monocyte. So here the vitamin A retinoids, they have a very important role in immune signaling mechanism, and it's going to enhance the class switchover depending upon the infectious etiology. It could be either an parasitic etiology or it could be an viral etiology. So in case of viral etiology, there is going to be abundant secretion of immunoglobulin A. Example, in case if I'm going to get a COVID infection, there is going to be an abundant amount of immunoglobulin A. So it's going to be a species specific immune response, and it depends upon the amount of vitamin A which we have in our body. In case at the time of infection, the vitamin A, if it's not in a normal concentration, the class switchover may fail. So in case if the class switchover is going to fail, like what is going to happen is that the repair mechanism is going to get hampered, and we are going to go for severe form of disease and severe form of infection. And again, like vascular monocyte to tissue macrophage, in case of any system, any subcutaneous infection like abscess, if there is not conversion of this particular vascular monocyte into tissue macrophage, what is going to happen is that the particular infection in the subcutaneous plane, they are going to have a severe form of complication. They can spread from one particular plane to another, and there could be like a big abscess like which is going to get formed, and it can complicate the particular condition. So this is about vitamin A. So do you guys have any doubt in vitamin A? Am I clear about vitamin A?
Yes, sir.
Okay, so vitamin A வந்து like predominantly it is going to have an effect over our eyes. So like whenever like we tell about vitamin A, like our vitamin A is all about eyesight. Again, like whenever like we have vitamin A, like we should also think about the immune mechanism. Yes, can you Dr. Dabashri, can you mute?
Yes, sir.
Okay. So now like we are moving on to the vitamin D3. So next vitamin, which is very essential for our human health, is going to be the vitamin D3, which is going to be an cholecalciferol. And again, cholecalciferol has its own activity. Number one is going to go and modulate the eosinophil activity, and number two, it's going to stop the autoimmunity, and it's going to prevent lymphoma. That is going to be number three action. So what do you mean by the term modulation of eosinophil activity? So whenever like when we are going to have an allergic stimulus, the first is WBC, which is going to come into the action, is going to be our eosinophil. So here, what is going to happen is that when we are going to get exposed to the allergen, this particular eosinophil is going to burst, and the histamine, which is going to be inside, be inside that particular eosinophil, is going to come out, and it's going to cause the reaction. So here, what it's going to do is that this particular vitamin D3, it is going to go and stabilize that particular mast cell and the eosinophil. Thereby, like it will not make the particular cell to rupture in case if the particular patient is going to get exposed to the allergen, and the eosinophil is not going to get ruptured. So that what is going to happen is that the histamine is not going to come out. So to some extent it can act as a membrane stabilizing activity. So and the second thing is going to be like it stops autoimmunity. So like we all know there is something called autoimmune disorder, like where our own immune system is going to act against our own self antigen, so which is going to end up in autoimmune disorder. So the classical example for autoimmune disorder could be our systemic lupus erythematosus and conditions like rheumatoid arthritis, where the antibodies are formed against our own self antigen, and those antibodies are going to destroy our antigen, resulting in something called autoimmunity. So again, vitamin D3 has a preventive role in the autoimmune mechanism. So what the particular vitamin D3 is going to do is that it is going to form a complex with the antibody, which is going to form against a particular self antigen, and it is going to inactivate it. So that is about the role of vitamin D3 in stopping autoimmunity. In case if the particular vitamin D3, if it is not in an adequate level, what is going to happen is that the patient have a high probability of going into autoimmune disorder like systemic lupus erythematosus, Sjogren's syndrome, and rheumatoid arthritis. And third one is going to be the lymphoma. And lymphoma, like recently, like we have seen several articles where the patient who's suffering from lymphoma, it can be either an so lymphoma, it is going to be a malignancy of lymphatic system, where the lymphatic system is going to go for the malignant transformation. And in lymphoma, like we have two type of lymphoma. One is Hodgkin and non-Hodgkin type of lymphoma. Again, these kind of lymphoma can be seen in all the age group. So from the pediatric age group to adolescent, adult, and older age group, like almost all the patients have the high propensity to go for the lymphoma. It could be due to post-infectious etiology. It could be like post-Epstein-Barr viral infection etiology, or it could be due to unknown etiology or idiopathic etiology. Again, this vitamin D3 have a preventive role in the apoptosis of lymphoma cell. Whenever there is going to be a formation of lymphoma cell, and this vitamin D3 can go and bind to those receptors of lymphoma cell, and they can make that particular malignant cell to undergo self-death, where the particular lymphoma cell is going to die, and there is going to be the failure of formation of that particular tumor. So this is about vitamin D3. So am I clear with vitamin D3?
Yes, sir.
So okay, so can anyone tell what is a very good source of vitamin D3?
Sunlight,
So
sir.
exposing,
Sunlight,
very good,
sir.
very good, exposing ourselves to the early morning
Exposing to
sun rays. So that
sunlight.
very good. So that is going to be a very good source of vitamin D3. And the other source of vitamin D3 could be our egg, it can be our cheese, it can be a milk,
Yes.
and tuna fish, and we have the green leafy vegetable. Like they are going to provide us with the vitamin D3. So vitamin D3 is going to be the
Honey.
cholecalciferol. And these are the three functions by which the particular vitamin D3 is going to act for the immune system. Okay. Now moving on to
Okay, sir.
vitamin E. So vitamin E is called as tocopherol, and the three functions of vitamin E towards immune system is going to be that, and it's going to be a powerful antioxidant, and it is going to increase the antibody response, and it's going to increase the interleukin 2 production. So I will get you through one by one. So it is going to be a powerful antioxidant. So whenever like we are going to have a lifestyle, like we are going to get exposed ourselves to a lot of stress and a lot of chemical exposure, and there is going to be formation of something called free radical. So whenever there is going to be a formation of free radical, these free radicals are going to cause damage to our cell, and this damage to our cell can be repaired by a particular structure called antioxidant. So we need this particular antioxidant to counteract those free radical. In case if there is not going to be an adequate antioxidant measure, what is going to be happen is that there is going to be a lot of free radical induced damage, and these free radical induced damage itself can hamper our immune system. Both cell mediated and humoral immunity can get hampered due to this particular thing, and there is going to be like development of any kind of autoimmune disorder or development of any infections due to the hampered immune response. And when I talk about cell mediated immunity and humoral, like cell mediated immunity is the immunity which is going to be through our immune cell, that is a cell mediated immunity. Example, our CD8 cell or CD4 cell, which is going to come in contact with the infectious pathogen and it's going to destroy it. So that is about the cell mediated. And humoral is going to be our plasma cell. So again, like that is particular lymphocyte called B lymphocyte, and these B lymphocyte are going to produce something called antibody, and with the help of that antibody is going to attack the particular pathogen. So that is about the humoral. Okay, so now like we are moving on to the second point, that is the increases antibody response. So antibody response is going to be our humoral immunity. So in case of any pathogen exposure, so our T cell is going to signal the B cell, and the B cell is going to convert into the plasma cell, and again that particular plasma cell is going to produce immunoglobulins of different class, and again that's going to be a class which over for which vitamin A is going to be responsible. So here, for increased antibody response, vitamin E plays a major role. So the more the antibody response towards an infection, there is going to be a good progression towards a particular infection. So there is going to be a rapid clearance of the particular pathogen from our body. And if there is the antibody response, if it's going to be very slow or if it's going to be hampered, so what is going to happen is that the pathogen is going to multiply in our body and going to cause various damage to our body. So in case if you want to have an increased clearance of the particular pathogen, we should have an increased antibody response. So again, like vitamin E is going to increase the antibody response in those kind of infection. So any kind of infection, it could be like any bacterial infection like an typhoid or paratyphoid fever or any brucella infection, or it could be any parasitic infection like schistosomiasis or entamoeba histolytica infection or giardiasis. Again, like in case of any viral infection, like a classical example can be our COVID. So for increased clearance, there should be an increased antibody response. In case if there is going to be a decrease in antibody response, there is going to be a hampering immune response, and there is going to be a decrease in clearance rate. In case if the clearance rate is going to be very low, so what's going to happen is that there is going to be like more chance of patients going into the complication. So here, like vitamin E can help in increasing the antibody response. And third thing is going to be the interleukin 2 production. So interleukin 2, so this is going to be actually an cytokine. So this is going to be a chemical which is going to modulate the immune response of other cell. So interleukin 2 again is going to be produced by a T helper cell, and the T helper cell is going to produce interleukin 2. With the help of interleukin 2, it is going to produce effect over the other cell. So that is the interleukin 2 production. So interleukin 2 production is going to act as a paracrine messenger, by which it is going to tell different kind of immune cell to act against a particular pathogen. Again, so here like vitamin E is going to play a key role in the production of interleukin 2. So am I clear about vitamin E?
Yes, sir.
Sir, one doubt, sir.
Oh, yes, madam.
Sir, like what is there any relationship between interleukin 2 production and any viral infection in our body, sir? Like in COVID, we used to do this test, sir,
Yes,
like
madam.
interleukin test.
Okay, madam. So in COVID, we do the interleukin testing, but it is not interleukin 2. So we go for more specific test. That is going to be the interleukin 6. So interleukin
6.
6 is
Okay.
going to have an, yes, madam, predictive marker. So in case if the interleukin 6 is going to be very high, so it is going to indicate
Okay.
the high chance of patient going into the shock. So most of the COVID patient, in case if their immune system is going to be hampered, so most of them they can go for something called MODS, multi-organ dysfunction syndrome,
The
and there can be
syndrome.
also
Okay.
like, yeah, madam. So like there is going to be like interleukin. It is going to be interleukin 6, not interleukin 2. So interleukin 6, if
Okay,
it's
sir.
going to be very high, it's going to have an adverse event towards the particular infection. So whenever like we talk
Okay.
about these interleukin, like we have several interleukins. So here, like this vitamin E is going to act only on interleukin 2.
Two.
And
Okay,
very
sir.
good
Okay, thank
source
you.
of vitamin E, yes, madam. Vitamin E is going to be our vegetable like broccoli, sesame seeds, and groundnut seed. And we have our avocado, and we also have our groundnut oil. So it is going to be a rich form of vitamin E. So this is about vitamin E. So any clarifications in vitamin E? So if no doubt, like we will move for vitamin K. So vitamin K is going to be our phyloquinone, and again it's going to modulate the T cell response. So like as I told, we have like two type of response. One is going to be our cell mediated immune response, and the another is going to be our humoral immune response. So whenever like we talk about a cell mediated immune response, we have two important cell which comes into the action: CD8 cytotoxic cell, CD4 helper cell. So in case of any infection like HIV, like this particular CD4 cell is going to come down, and there is going to be a failure of regulatory mechanism. So here this vitamin K is going to specifically act on the cell mediated immune response cell, that is going to be the T cell. So T cell, again, like we have two cell. One's going to be the cytotoxic T cell, that is CD8, and we have something called CD4 cell, which is a helper cell which is going to modulate the immune response. So we will see one by one again. So cytotoxic T cell. So what the particular cell is going to do is that, so it is going to act against the particular infection, and it is going to act against an intracellular pathogen. So whenever like we are going to have a particular WBC which has ingested a particular cell, again this particular cytotoxic cell will help to kill the particular organism along with the cell. And we have something called as the helper T cell. So helper T cell, again, like the particular cell is going to regulate the immune response. So the helper T cell is going to tell the neutrophil to do what function, monocyte to do what function, eosinophil to do what function. In case if the particular T cell, cytotoxic cell and helper T cell role is going to get destroyed, the entire regulatory system get failed, and it can end up in the dissemination of various infection, and they're going to cause severe forms of infection. Example, it can be like a simple infection like a simple skin abscess, which can disseminate throughout the body. So these are the example for modulatory response. So it is going to modulate. So vitamin K will help the particular T cell in recognizing various antigen and various activity. So it's going to have an modulatory effect towards an T cell. Both helper T cell and the cytotoxic T cell is going to regulated by this particular vitamin K. So any doubt in vitamin K?
No,
Sir,
sir.
one doubt, sir.
Yes, madam.
Sir, there is another T cell called T suppressive cell, sir. Is there any role for suppressive T cells?
Okay, suppressor T cell,
There
like
are,
these are the particular.
yes,
Okay, yes.
yes, sir, yes, sir.
So like, can you be clear with your question?
Sir, T cells are a cytotoxic, helper, and suppressor cell. Three types now, sir. Is there
Yes.
any role for suppressor cells? Is this
Okay.
modulate also the suppressor cells, sir?
Okay, so suppressor cell. Okay, you want to know whether it's going to have a modulatory effect. Okay, so suppressor T cell. So whenever like we talk about suppressor T cell, like it is a component of CD4 cell. Okay, so like we have seen like CD4 and CD8. So suppressor T cell is going to be a model and fraction of CD4 cell. So main activity of suppressor T cell is going to be an dominant immunological tolerance response. So there is something called immunological tolerance, so where our own antigen is get tolerated by our immune system. Okay, so example, there can be an antigen which is an host antigen. So usually like against a host antigen there will not be any formation of antibody. So for those kind of immunological tolerance, the suppressor T cell plays an important role. So here, like
Okay, sir.
this particular cell is not going to have a role over the particular suppressor cell, but it's going to have a generalized role over the regulator cell and the cytotoxic cell. And
Okay, sir.
mainly
Thank
vitamin
you.
K will have a very good effect over the cytotoxic T cell. In case any infection like Neisseria gonorrhea, like the particular organism is going to thrive inside the particular cell. So those kind of cells needs to be killed with the help of cytotoxic T cell. So without cytotoxic T cell, those particular cells may escape. And another important point about vitamin K is that, and it's going to modulate the effect of cytotoxic cell. And the cytotoxic cell is a cell which is going to kill the cancer cell. Whenever there is going to be a formation of cancer cell within our body, this particular cell is going to kill that particular cancer cell. Again, like vitamin K plays an important role in indirectly counteracting the various cancers. So in our human body, like we have wide range of DNA mutations happening. So each and every day, like 1 or 2 cancer cell will be forming in our body, and it is taken care by our immune surveillance mechanism, mainly the cytotoxic T cell. So here, like vitamin K plays an important role in modulating the immune response against those malignant cells. So this is about vitamin K. So now, like we will move on to the water soluble vitamins. So predominantly vitamin C, vitamin B, and the various vitamin B, like I'll go through. So now we are moving on to vitamin C. Well, like you all know, like during the COVID season, like we all exposed to the COVID, and we all know the power of vitamin C. So can anyone tell just about vitamin C? So vitamin C is like what's the rich source of vitamin C?
Citrus
Citrus
fruits, sir.
fruits, sir.
Very good.
And
So yes,
deficiency
vitamin.
may cause scurvy.
Very good. So deficiency is going to cause scurvy, a
As
collagen
for
vascular
difference.
disorder. Very good.
Yes,
So
sir.
here, like vitamin C, one of the most important vitamin. So it is going to be an water soluble vitamin, and rich source of vitamin C is going to be our citrus fruit. So again, like this particular vitamin C is going to have an action towards both innate immunity and adaptive immunity. So both cell mediated and humoral immune response, like it is going to have an important role. Starting from neutrophil, like a granulocyte like neutrophil, to a granulocyte like lymphocyte, it's going to have a predominant effect. So neutrophil, it's going to have an action called neutrophil migration. So what is neutrophil migration is that that particular neutrophil is going to be inside our vascular system. So whenever there's going to be a localized infection, example and meningitis, so what's going to happen is that from the vascular system, the neutrophil, like it will go from the vascular system, it's going to migrate from the vascular system to the source of infection. So it could be any abscess, or it could be anything like an appendicitis. So from the vascular system, the particular neutrophil will migrate towards the site of infection. So that is the neutrophil migration. And neutrophil chemotaxis. So chemotaxis is attraction towards the inflammatory site. That is the chemotaxis. And phagocytosis activity is nothing but the ability of the particular neutrophil to ingest the particular bacteria and kill it. So that is about the phagocytosis activity. And oxidant generation, like whenever there is going to be an anything like an cancer cell, there's going to be an free radical generation. So that is the oxidant generation. So to some extent, the particular neutrophil can act against those cancer cells. And
Sir,
the other
your voice is breaking.
mechanism is going to be the signaling mechanism
So sorry, I would like to interrupt. So your voice is breaking
by
and the screen is not being
which
shared.
particularly come into the action. Like lymphocyte can can get activated, and indirectly the cytotoxic cell can get activated, and the cytotoxic cell can act against a particular cancer cell. So that's a signaling mechanism. Are you guys able to hear me now? Okay, like now we'll move on to the macrophage. So can anyone tell about macrophage? What is a macrophage? Yes, can you guys reply? Can you guys able to understand what I'm telling?
Please repeat, sir. Your voice is breaking, sir.
Okay, were you able to hear me now clearly?
Yes,
Yes,
sir.
sir.
Now it's clear, sir.
Okay,
Till
okay, thank you. So
phagocytosis, it's clear, sir.
okay. So again, like I will repeat, like neutrophil migration and neutrophil chemotaxis and phagocytosis activity, and we have something called oxidant generation. So whenever like we are going to have an abnormal cell, there is going to be generation of free radical. So again, like those free radical are specific to that particular cell. Example, there could be any formation of something like a cancer cell against which that particular oxidant molecule is going to act. And other mechanism by which the neutrophil is going to act is that by the signaling mechanism. So whenever there is going to be any abnormality in the human body, there is going to be a signaling mechanism by which the particular cell is going to activate the other cell like lymphocyte. Again, the particular lymphocyte can activate the cytotoxic cell, and by particular mechanism it can act differently. So that is about the signaling mechanism. So am I clear about neutrophil?
Yes, sir. Clear, sir.
Okay. Okay. So now we are moving on to macrophage. So here, like, you all know, like, what is called macrophage. So can anyone tell what is a macrophage?
Sir, it's a form of WBC, sir. Its action is at the time of infection, it reaches there and engulfs the
Very
parasites
good.
or
Very good.
foreign body.
So that is about the macrophage. So macrophage is a very important cell in our human body. So it is going to have an motility movement. So when we are going to see it under the microscope, it is going to wander here and there, and it's going to kill the parasite or any
Motile.
organism which is going to
Hmm.
come. Yes, it's going to be a motile organism, motile WBC. So it is going to feast on the particular organisms like bacteria. So this particular cell is the main cell which is going to prevent various infection like typhoid and brucella infection, and even like certain to some extent even plasmodium it can engulf. And the thing about
Hmm.
macrophage is that certain organisms like Neisseria meningitis and Neisseria gonorrhoeae or any capsulated organism will escape this particular macrophage. So again, this
Yes, sir.
macrophage
It
needs to get,
will grow inside the macrophage.
yeah, so like this particular macrophage it needs to get activated for the particular cell to get acted. So the preliminary form of macrophage is going to be the monocyte. The monocyte is the one which is going to get converted into the macrophage. So again, like this particular macrophage should get activated. So again, like vitamin C plays an important role in activation of macrophage, thereby it is going to go and attack the particular organism. So that is about the macrophage activation. And phagocytosis, again, like whenever like this particular macrophage is going to go and eat the particular bacteria, there has to some mechanism happening inside that particular macrophage for that particular organism to get killed. So there is something called phagocytosis. So can anyone tell what is phagocytosis?
Cell
Engulfing,
eating
sir.
mechanism, sir.
Very good. So the particular
Releasing or
macrophage is going
engulfing.
to, very good. So macrophage is going to engulf the particular organism. It is going to kill it inside the particular macrophage. So that is the phagocytic activity. So with the help of this particular macrophage activation and phagocytosis activity, it is going to have an clearance activity. So there is going to be a rapid clearance of organism from the body. So thereby it's going to help our immune system or our human body to clear the particular pathogen, and we will get freed of the particular organism. So this is about the macrophage. And there is something called natural killer cell. Again, natural killer cell is going to be like similar to macrophage. It's going to have a similar effect, but other than macrophage activity, it's going to have an self antigen activity. So it is a main cell which is going to kill the cancer cell. In case if there is going to be formation of anything like a cancer cell, this natural killer cell will recognize it and it will go and engulf it. So this is about the natural killer cell. And we have the two type of A granulocyte, that is the B lymphocyte and T lymphocyte. So you all know B lymphocyte is the cell in whenever there is going to be any infection, this particular B lymphocyte it's going to converted into plasma cell, and this plasma cell is going to produce antibody of various nature. In case if it is going to be an parasitic infection, the antibody class switchover which is going to take place is the formation of immunoglobulin E. In case if it is going to be an acute infection, it's going to be IgM. Or in case if it's going to be a chronic infection, it's going to be IgG. So again, like it is going to act on the B lymphocyte to convert the particular B lymphocyte into the plasma cell, and it also helps the plasma cell to produce various forms of antibody which is specific for the particular infection. And we have something called T lymphocyte. Again, like T lymphocyte, we have T helper and cytotoxic T cell. Again, like there is going to be T cell proliferation and there is going to be a polarization. So polarization is a particular nature like where the particular cell can undergo differentiation. Like example, T helper 1 can become T helper 2, and T helper 1 can become a suppressor cell. So that's the polarization. And it can also have an cytolytic activity and delayed T hypersensitivity reaction. So can anyone tell what is DTH reaction? So any medical students in this group who can tell
Delayed
about
type
delayed
hypersensitivity reactions, sir.
very good,
Like
delayed T
Mantox,
hypersensitivity reaction.
uh,
Very good, like Mantox test
in
which we do for
MTB,
screening test as a,
sir. In
very good,
MTB,
very good.
yes, sir.
Very good. So MTB stands for Mycobacterium tuberculosis. So it's going to act as a screening test for Mycobacterium tuberculosis infection. Very good. Okay, so this is about the vitamin C. So vitamin C is going to have an enormous activity towards both innate and both adaptive immunity. So like any in case of any infection, like we doctors like we usually prescribe this particular vitamin C in the range of 500 milligram to 1 gram per day. And the thing about vitamin C is that we should not take this particular vitamin C for a longer period. In case if you are going to take it for a longer period, like it can end up in formation of oxalate stone. So most of the time, like we are going to use this particular vitamin C, like whenever the patient is going to have an infection. So that way we can promote the immune activity, and we can also clear the infection at a faster rate. So during COVID time, like you all will be aware of this particular vitamin C. Okay, it's available in both oral and injectable form, this particular ascorbic acid. So this is about vitamin C. So any doubt in vitamin C?
Sir, we should not, you have said you should not take longer period. Why, sir?
Yes. So vitamin C, like whenever like we are going to talk about an vitamin and mineral, so these are they have something called required daily allowance. So like the required daily allowance is going to be like very low for almost all the vitamin. So we are going to increase the vitamin such that it is going to have an effect over the innate and adaptive immune response. So here this particular vitamin C, the ascorbic acid. So one of the side effect of vitamin C is the acidification of urine. So whenever there is going to be an acidification of urine, there can be formation of stone. So certain crystals can get formed in acidic urine. Okay, so there is going to be a formation of
Okay, sir.
stones in certain patient, and there are even certain stone
Sir,
which can
thank you.
get formed in alkaline urine. Okay, so here like it is going to acidify the urine, thereby going to promote the crystal which is going to get formed in acidic urine, and those crystal can get precipitated at the higher acidic pH, and there is going to be formation of stone. So now clear about vitamin C?
Yes,
Yes,
sir, I
sir.
have
Clear,
one
sir.
query.
Yes.
Sir, whether if the natural supplement also can cause the formation of stones or only that if you are taking the supplement?
So
If
actually,
it
like
is taken
supplement,
naturally,
like
yeah,
natural
please.
form of vitamin C, like the amount of vitamin C which is going to be present in that particular element is going to be very less. It is not going to be like 500 milligrams. So most of the time we prescribe in the form of a tablet where the concentration is going to be too high. So whenever there is going to be the concentration very much higher, like what is going to happen is that our kidney is going to get eliminated out. So it will take up the necessity amount of vitamin C inside our body, and remaining vitamin C is going to get excreted in the urine. Okay, so we are just
Okay,
giving a vitamin C such that like only the like in case if you are going to administer 500 milligram of vitamin C, only up to like 200 or 250 milligram will get absorbed. Remaining is going to get sent out, and it depends
thank you,
upon
sir.
the our our need for the vitamin C.
Thank you, sir. Thank you.
Okay, okay. So next, like we will move on to vitamin B1. So that is the thiamine. So again, like the lot of cereals and the fish, like it's a rich source of thiamine. Again, like people like who are like alcoholics, they are going to go into these kind of deficiency, thiamine deficiency. So
Thiamine
that's why like when
deficiency, yes.
yes, thiamine deficiency. So like whenever like we see an alcoholic patient, like the first thing which supplement which we go for them is going to be our thiamine. So again, like this is going to have an impact over the T cell development and maturation. So whenever there's going to be an T cell, so there's going to be a stem cell from which the progenitor cell is going to arise. So progenitor cell, again, like we have two progenitor cell. We have the lymphoid and myeloid. Again, from the lymphoid, like we have the T cell and B cell. So again, for this particular T cell to develop and mature, this vitamin B1 is going to play an important role. In case if the patient is going to go for deficiency of thiamine, there is going to be a failure of T lymphocyte development and maturation. In case if there is going to be T lymphocyte development and maturation failure, if it's going to be there, the patient is going to go for something called cellular immunity deficiency. So cell mediated immunodeficiency disorder they will go for. Okay, so this is about vitamin B1 thiamine. Now like we are moving on to vitamin B2, which is the riboflavin. So riboflavin, again, towards immunity, it's going to have an antioxidant response, and it's going to have an immune response modulatory activity. So can anyone tell what is an antioxidant? So for vitamin E and vitamin A, like we studied about antioxidant activity. So can anyone tell?
It fights with free radicals, sir.
Very good. So like it's going to fight with the free radical. So what is the role of a free
Yes,
radical in
sir.
our body?
It will damage the
Cause
normal
oxidative
cells.
stress. It will
Very good.
oxidative burst. It may cause oxidative burst.
Very good. So it is going to cause a severe oxidative stress and also the oxidative burst. So it is going to damage both the cell mediated and humoral immune response. So here it's going to have a
Yes, sir.
protective effect against those free radical. Okay, so it is going to have an antioxidant role, and it's also going to have an immune response modulator. So like it is going to modulate the immune response. So it is going to tell the cytotoxic cell like when to act. It is going to tell the suppressor cell to when to act, and it is going to tell the neutrophil like when to act. So that what is going to happen is that the particular cells will not act in the overly manner. So it is going to have an response, that is something called immune response modulation. So it is going to modulate, or it is going to regulate the immune response of certain immune cell like neutrophil, monocyte, eosinophil, or T cell.
And T cell again is going to regulate both the helper T cell regulatory function and the cytotoxic function. So this is about riboflavin. And we are moving on to vitamin B3, that is a niacin. And niacin have a like lot of effect it has, and predominantly it is going to have an effect over neutrophil and damage of like it's going to repair the DNA damage. So it's going to increase the neutrophil. So can anyone tell what is the role of neutrophil in our body, whether it's going to act against the bacteria or virus?
Bacteria,
So
sir.
like whenever, very good, it's going to act against the bacteria. So whenever like we are going to have a variety of pathogen, so our WBCs are in such a way that each cell is going to act against each particular pathogen. Example, in case if it is going to be neutrophil, it's going to act against the bacterial pathogen. In case if it is going to be an
Yes.
virus, the first cell which is going to get increase is going to be our lymphocyte. In case if it is going to be an parasite, the cell which is going to get increase is going to be
eosinophil.
our eosinophil. Okay, very good. So there is going to be an increase in neutrophil level. So whenever like we are going to see a patient who is going to suffer from something called neutropenia, it could be a drug induced neutropenia, or the patient can be having a bone marrow failure. So again, like vitamin B3 could be very much useful in increasing the neutrophil production. So in case of any cancer patient, like we are going to put the patient on chemotherapy. Like those chemotherapy drug, like what it can do is that it can suppress the bone marrow, and the patient can go for
Yes.
neutropenia. So again, like if there's going to be neutropenia, there's going to be a high chance of infection with bacterial pathogen. So for increasing the neutrophil level, like we can go for vitamin B3, which is nothing but the niacin. And DNA damage, again, like DNA damage can result from variety of substance. The main substance is going to be a free radical. So whenever there's going to be a free radical, there's, in case if there's not adequate amount of vitamin E, so it is going to however cause the DNA damage. Again, this particular DNA damage has to be overcome. Okay, so this particular DNA damage can be repaired by this particular vitamin B3, that is a niacin. So this is about vitamin B3 niacin. So any doubt in this particular vitamin B3? Can we move with the next vitamin?
Yes, sir.
Yes, sir.
Okay. So now like we are going to go for vitamin B4. So vitamin B4 actually it is not a true vitamin. So we doesn't have something called vitamin B4, but still in our literature like we have something called adenine, which is like denoted as vitamin B4. Again, like vitamin B4, like this particular adenine, okay, it's going to be seen in food material like soy paneer and soy milk. Like most of us, like we hate this particular thing like soy paneer and soy milk. Like whenever like we are going to deal with weight loss, like we are going to go for from normal paneer, like we are going to go for soy paneer. From normal milk, we are going to go for soy milk. The taste is going to be like very bad, but again, like it is going to have an substance called adenine, which is denoted as vitamin B4. It is not a true vitamin, and this particular vitamin is going to act as an paracrine messenger. So what is a paracrine messenger is that, so whenever there is going to be a pathogen which is going to enter our body, example a particular COVID virus which is going to enter the lung, so the alveolar macrophage, their particular alveolar macrophage will release some substance. So that particular substance will alert the other immune cell, stating that something wrong is going on in the lung, some pathogen has entered. Okay, that is the paracrine messenger. So for the particular release of paracrine messenger, this adenine is going to play a very important role. In case if the patient is not going to have an very good level of adenine, what is going to happen is that the paracrine messenger response is going to be very slow. In case if the paracrine messenger level is going to be very slow, the messenger activity is going to get hampered, and other cell in our human body will not get alerted. So what will happen is that these kind of patient will go for severe form of complication. Okay, so these are the reason why. So certain diabetic patient, so most of the diabetic patient, like naturally like their adenine level will be very low, and these kind of patient, like they will be going for severe form of complication, example like our classical COVID infection. So this is about paracrine messenger. So any doubt in this paracrine messenger?
No, sir. So why it is named as particularly adenine, sir? Because of
No,
because
it is not a true,
uh,
it is not a true vitamin actually. Like we cannot tell it as a vitamin. So vitamin B4, like it is a misnomer actually. But as per various literature and biochemical notes, like vitamin B4 is denoted as adenine. It's only denoted. It's not an
okay,
adenine is not a true vitamin B4. Okay, even
okay,
like
sir.
certain literature like state that even levocarnitin, even like it is denoted as vitamin B4. But in majority of the literature, like the adenine is going to be like denoted as vitamin B4. That is why, like I have mentioned, it is
Okay.
not a true vitamin. Okay,
Sir,
so now
except
like we are,
soya,
yes,
yeah,
yes.
except soya, any other source of this Vitamin B4?
Okay, sir. Adenine, like it is a very rich source. Example, in case if it's going to be an legume or beans or any
Oh,
breakfast cereal, like they are going to be a very rich source of adenine.
and if
So other
sprouts and
than
all
that,
will,
the
okay.
yes, a sprout like it's a rich source of adenine. But in case if you are going to allow that sprout to germinate, the adenine concentration can go down. During the particular germination process, the adenine can get utilized. So when you are going to allow that particular sprout to grow sprouted out, like the adenine concentration can go down. So the rich source of adenine is going to be our soy paneer and the soy milk. So most of them, most of my patients, they hate this particular soy paneer and soy milk, so they don't like the taste, but still like it's going to be an very good for their health and also the immune system.
Thank you, sir.
Okay.
Okay. So now we are moving on to vitamin B5, that is the pantothenic acid. So how many of you have white hairs? So being in your 20s, 25s and 30s, so how many of you have
Sir, one or
white hair?
two white as well. One or two.
Okay, so this particular pantothenic acid deficiency can lead to some condition called canititis. So canititis is nothing but premature graying. So this is one of the vitamin. So here, like again, like this particular vitamin can have an activity over the immune cell. So it's going to have an activity like anti-inflammatory activity, and it's going to have an activity against autoimmune disorder, and it's going to promote innate immunity against mycobacterial tuberculosis by macrophages. So we'll see one by one. So there is something called anti-inflammatory activity. So can anyone tell like what is an inflammation?
This is swelling,
Okay, so but
warmth,
like with
pain,
the okay
redness.
with our okay, as era goes, like we are moving towards like lot of spicy food, and we are going to have a very bad lifestyle, like ingestion of alcohol, like tobacco use. So these kind of molecule, like what it's going to do is that it's going to act as an pro cytokine, and it's going to cause variety of inflammation. Like classical like example for inflammation could be our inflammatory bowel disease. So it's mainly due to our poor lifestyle habit and poor food habit. So again, like those kind of inflammatory bowel habit, it's predominantly due to our own inflammation, which is going to have an damage towards the particular intestinal mucosa. So that is why the particular inflammatory bowel disease is going to be there. And this kind of anti-inflammatory can act against those kind of inflammatory diseases like inflammatory bowel disease. So it could be our ulcerative colitis or Crohn's disease. So again, like this vitamin B5, pantothenic acid, can have an anti-inflammatory effect by which the particular inflammatory bowel disease like uh, Crohn's disease or ulcerative colitis can get like it can, like we can heal it. Okay, like we cannot cure it, but we can heal it. Okay, and it's also going to hamper like autoimmune disorder. So can anyone tell what is an autoimmune disorder? So in autoimmune
Our
disorder,
own
again, like our
immunity will act upon our own cells.
very good. So
Our
our own
own.
immune cell is going to very good. So our own immune cell is going to act against the particular antigen, our host antigen. That is the autoimmune disorder. Again, this pantothenic acid can be useful in avoiding the autoimmune disorder. So there is going to be something called the surveillance mechanism. So like it's going to tell our regulatory cell, like it will tell that particular cell, like it is going to be an host cell, like please don't go on attack. Okay, so this vitamin B5 molecule, again, it can act as a messenger molecule by which it can regulate the T cell, mainly the cytotoxic T cell, and it can tell like it is going to be our host cell, so don't attack. Okay, so whenever there's going to be a deficiency of pantothenic acid, the level of autoimmune disorders can be very high. Okay, like we have seen like nowadays, like with the poor lifestyle habit, like we are seeing like lot of autoimmune disorder. Like one among the cause of this particular autoimmune disorder could be the vitamin B5 or
SLE,
pantothenic acid deficiency. Very good, SLE. So systemic lupus erythematosus or rheumatoid arthritis or Sjogren's syndrome. So these kind
arthritis.
of
Yes.
very good. So these kind of disorders can arise due to this vitamin B5 deficiency. And one of the main activity of vitamin B5 is preventing ourselves from TB. So you all know like TB is going to be the opportunistic infection. So like myself, I'm in hospital and I will be inhaling lot of tubercle bacilli every day, but I'm not going to develop the infection. But in case if the patient with very low immunity, they are going to go for the infection. Again, like this particular this vitamin B5 will go and help macrophage to kill the Mycobacterium tuberculosis. So whenever like when I'm going to engulf or I'm going to inhale the particular Mycobacterium tuberculosis, like my macrophage can kill it. Okay, so for killing that particular tubercle bacilli, it needs vitamin B5, which is the pantothenic acid. So without pantothenic acid, the particular tubercle bacilli can escape inside the macrophage and can cause severe infection. Okay, so this is about vitamin B5 or pantothenic acid. Again, like pantothenic acid, like it is going to be there in high concentration in brown rice or Kerala rice, and in oats and in fruits like avocado. So this is about vitamin B5. Any doubts in vitamin B5? So can we
No,
move on
sir.
to our next? Okay.
Yes, sir.
So we'll move on. Okay, so we'll move on to vitamin B6 or pyridoxine. So like vitamin B6 or pyridoxine, again, like it's going to have an effect over the stem cell, like the progenitor cell in the bone marrow. So it's going to have a good function over the WBC production. So thereby there is not going to be any maturation failure or differentiation failure. And it's also going to regulate the immune cell. So we know like what is a regulatory mechanism by which it's going to act. So we have the T helper cell and cytotoxic T cell and how it is going to act. So it's going to have an effect over the WBC maturation and WBC differentiation and also the regulation. So the food which is going to be very high source of vitamin B6 or pyridoxine is going to be the chickpeas. And in case if it's going to be a non-vegetarian, it's going to be a meat liver. So this is about vitamin B6 or pyridoxine. So with this, like we are moving on to the next vitamin, that is a vitamin B7 or biotin. So whenever we imagine about biotin, so we take it for what?
Hair growth, sir.
So very good. So hair and skin and nail. So whenever like we imagine about our glorious skin and we want lot of hair, like immediate idea which comes in our mind is going to be the biotin. So again, like this particular
Yes.
biotin, like everywhere, like in case if they are going to search in the Flipkart and Amazon, like there are like lot of brand of biotin with a different concentration of biotin, right? Okay, so again, like
Yes,
this
sir.
particular biotin, again, like it is going to have an good effect over our immune cell. So it, again, like it is going to have an regulatory mechanism towards the T cell and natural killer cell. So we know what is the regulatory mechanism of T cell. It's going to tell the T cell to kill what cell and help what cell, and this is going to be the regulation of T cell. And there is going to be something called regulation of natural killer cell. So natural killer cell is the cell which is going to roam inside our body, and it will be having a surveillance mechanism. So whenever there is going to be a formation of any abnormal cell or any cancer cell, this particular natural cell will immediately go and kill it. Okay, again, this biotin can help the particular natural killer cell to recognize those abnormal cell and can kill that particular cell. Okay, so the which source of this particular B7 biotin is going to be our almond, cauliflower, then we have cheese, mushroom, and sweet potatoes. Actually, like we doesn't need to go for any supplementation. In case if we need any supplementation, we can go for 5 microgram. Okay, not more than 5 microgram is actually needed for our supplementary purpose. And the most of the time, like our the food which we eat, like almond, cauliflower, this itself is enough to meet the required daily allowance. Okay, so this is about vitamin B7 or biotin. And we are moving on to vitamin B8 again, and is the second vitamin which comes under vitamin B, and it's regarded as a not a true vitamin. Okay, it's going to be the inositol. So the various things like badam, pistas, and cashew, and beans, and a lot of fruits, they are going to be like rich source of inositol. So inositol is going to be a sugar molecule actually. Again, like it has to be like classified under the macronutrient, but due to its activity and various disease hampering effect, it is put under the vitamin. Again, it's not going to be a true vitamin, like it is denoted as vitamin B8, and it's going to have an antioxidant activity. So like you all know, like what is an antioxidant activity, we have seen a lot of vitamin like which is going to have an antioxidant activity against free radical and free radical induced damage. Okay, so with this, like we'll go for vitamin B9 or folic acid. So whenever like we think about folic acid, what comes in your mind?
Uterus.
So in case if there is going to be
Uh,
folic acid
um,
deficiency in pregnancy, what will
Deficiency
happen?
leads to anemia, sir.
Very good, anemia. And in case if folic acid is going to be like in case of folic acid and pregnancy, what will happen?
Neural
There
tube
is high
defect,
chance.
sir.
Very good. Neural tube defect and Down syndrome, like there can be like high chance of neural tube defect with the folic acid deficiency. Again, this folic acid can also go for T cell regulation. So T cell regulation, like like there is going to be regulation of both cytotoxic and helper T cell. So cytotoxic T cell is going to have like killing effect, and helper T cell is going to have an helper effect towards the other particular cells. Okay. So again, this particular folic acid towards immune system, it is going to have an immune regulatory mechanism, mainly our T cell. Okay, cell mediated immune cells, not the humoral one. Okay, so this is the vitamin B9 and folic acid. Again, like vitamin B9, like rich source could be our avocado, then we have the banana, we have orange, then we have our carrot, and we have the beans and broccoli. So these are the rich source of folic acid. Okay, again, like in case if the patient is pregnant patient or patient is going to have a severe stress, like we usually recommend this particular folic acid. Okay, so this folic acid is
INT.
going to have a tremendous effect over those kind of patients. Okay, mainly like we prescribe this folic acid for pregnancy to avoid a neural
Yes.
tube defect.
Defects. Yes.
Okay, so with this, like we are moving on to vitamin B12 or cobalamin. So can anyone tell like what is vitamin B12?
B
So
complex.
deficiency in
Covalent.
vitamin B12 may cause um,
Very good. There is something called megaloblastic anemia. So there is going to be something called an
Yes,
anemia called
yes.
megaloblastic anemia. So again,
Myeloblastic.
deficiency
Yeah.
of this particular cyanocobalamin or cobalamin molecule can end up in something called anemia, which is going to be
pernicious
the
anemia.
pernicious anemia. Very good. Again, like towards a particular immune system, like it is going to have an immunomodulatory effect. Again, like it is going to be the cell-mediated immunity, not humoral. Okay. So with this, like, can anyone tell what is cell-mediated immunity and humoral immunity?
The cell-mediated immunity by T cells, we get the immunity by
Very
T
good.
cells like CD4, CD8, sir. But immoral
Very good.
plasma cells, it will
Very good.
Production of
immunoglobulins will be
antibodies.
secreted, sir. Later, plasma cells can be converted into memory cells.
Very good. Okay. So those are the humoral immunity. Very good. So okay. So this is going to have an immunomodulatory effect towards cell-mediated immunity. Okay. So again, like rich source of cobalamin or cyanocobalamin is going to be the fish, almond. Then we have the cheese, then milk. Then we have the red meat, egg, chicken, mainly like chicken breast. So those are have good. Those are the food substance which is going to be high in cyanocobalamin. Okay. So this is about vitamin B12. So with this, like we are ending up vitamins. Okay, like now we are moving on to mineral, essential mineral, like towards which is going to have a good effect towards the immunity. Okay, so now iron. Okay, can anyone tell what is an iron?
Ferrous.
Very good. Ferrous compound. It could be an ferrous sulfate or it could be ferrous citrate. So it is going to be an iron compound. So iron, like it
Yeah.
is going to have a key role over like many functions in our human body. Okay, whenever there is going to be a deficiency of iron, it is going to end up in iron deficiency anemia. So that particular iron
Anemia.
deficiency
Yes.
anemia, when it's going to be there, like it is going to signify or denote the presence of some other condition. Most of the time, like we human, like we don't go for iron deficiency anemia unless like we are going to have a deficiency of iron. So most of the time, like most of the food which we eat are rich in iron. In case if we are going to have an iron deficiency, like it can denote some kind of infection which is there in the human intestine. It can be any hookworm infection. So those hookworm can be drinking blood, or there can be blood loss which can subsequently go for iron deficiency. Okay, again, like here, like it's going to have an immune response called infection specific immune response. So this particular iron can help in infection specific immune response. Again, example, in case if any parasite is going to come inside our body, example any hookworm infection, this iron will regulate the function of eosinophil. Those eosinophil can produce something called immunoglobulin E. Those immunoglobulin E can act against the parasite. So those are the species specific immune response. In case if it is going to be an primary dengue fever, again there is going to be formation of immunoglobulin of class M. Okay, so those are the species specific immune response. Again, in case if it is going to be any bacterial infection, example, it could be like bacterial keratoconjunctivitis. So the first cell which gets activated is going to be the neutrophil. For that particular activation of a species specific immune cell, like we need iron. Okay, again, like rich source of iron, like you all know, there's going to be the dark chocolate, which is going to be a rich source of iron, and green leafy vegetable. Okay, and we have the dates, so they are the rich source of iron. And the other thing can be the broccoli, red meat, then a lot of fruits, then pumpkin seed and tofu. So those are the rich source of iron. Okay, so can anyone tell, pertaining to the iron, can anyone tell what are the various food molecule which should not be given with iron? There are certain food substance which should not be given with iron. In case if you are going to give that along with iron, there is going to be chelation, and both iron and the other compound is not going to get absorbed and is going to sent out in the feces or stool. So can anyone tell
Charcoal,
what is
sir.
it? It is calcium. Okay, we
Calcium.
should never calcium. We should never give iron along with calcium. So like we have certain practice where we mix lion dates along with milk and give. Okay, like we should not do. Okay, when we are going to mix calcium with iron, there's going to be something called chelation. Both iron and calcium will not get absorbed. It gets chelated and it's going to send out in the feces. Both of them will not get absorbed. Instead, like you can give iron along with vitamin C, ascorbic acid. So both iron and vitamin C is going to get absorbed. Okay, so this is about the absorption of
Net
iron.
problem.
Yes, can you hear me? Were you able to hear me?
Yes, sir, you are audible.
Yes, sir.
Okay. Okay. Now we are moving on to zinc. Okay, so zinc again, like when we were dealing with COVID, like after vitamin C, like we have been dealing with the zinc. So anyone have an idea about zinc? What is zinc? So almost all the pharma company, they have mingled this particular zinc with vitamin C, and they were providing it to the general public. So it is about the zinc. So zinc again, it's going to have an innate immunity or mucosal immunity. Again, this particular mucosal immunity plays an important role. Example, it can be an mucosa associated lymphoidal tissue, or like it is going to act, it is going to provide an immune response against the pathogen which is going to cause infection of lung and intestine. Okay, it's going to be an innate immune response. Okay, so can anyone tell like what is innate and adaptive immune response? So any medical students in the group
Ma'am,
who can
sir,
tell like,
innate is inborn immunity, sir. Adaptive is when
very good.
we get immunized or when we get an vaccination, we get adaptive immunity. Adaptive
Okay, so
immunity.
innate, very good. So it's going to be the adaptive
Innate
immunity.
is
So here like
inborn.
zinc.
Yes, sir.
Okay, so zinc is going to play an important role in innate immunity. So mucosal immunity predominantly. So predominantly like formation of secretory IgA, which is going to have an antibacterial activity. Okay, so now like we have the selenium again, like the selenium, like this have an effect over the various immune cells. So it is going to protect against the free radical. So it is going to act as an antioxidative, it's going to act against the oxidative damage. It's going to act similar to the antioxidant selenium. Okay, so again, like cheese, nuts, eggs, oats, they are rich source of selenium. So this is about selenium. So the amount of selenium which we need is actually like very low. So in case if you are going to take selenium for a longer time, it can produce a lot of side effect. Okay, so the selenium, like it is like the required daily allowance is going to be really very low, and it's going to form something called selenom protein, and this selenom protein is going to play an important role in antioxidative or oxidative. It's going to counteract the oxidative stress effect. Okay, so next we are moving on to calcium. So calcium again, like resource of calcium, we know like curd, milk, broccoli. Then we have like fish. So those are the resource of calcium, and again, like it plays an important role in something called immune cell migration. So we have neutrophil chemotaxis, neutrophil migration towards the area of infection, and it's also going to modulate the immune response like cytokine secretion. So like we have a lot of cytokine, like it is going to regulate the cytokine type, like we have studied like interleukin 2, then interleukin 6. So it is going to regulate the immune cell to produce a specific type of cytokine in response to the specific infection. Okay, so this is about the calcium. Now phosphorus. So phosphorus, like we have something called galt barrier. So can anyone tell what is galt? I know it's quite a bit difficult. Can anyone tell what is galt?
Gut associated lymphoid tissue.
Very good. Galt in this is going to be gut associated lymphoidal tissue. So these are the lymphoidal tissue which is going to be there in the respiratory tract and also the intestine. In case any intestinal pathogen, like it will be helpful in avoiding this particular infection from coming inside the body. Example, it could be our Campylobacter jejuni or anything like Helicobacter. Like those are the infection which will be like confined to the
Helicobacter
uh,
pylori.
Very good. So those are the infectious pathogen which is going to get confined to the mucosa and it's not going to enter the bloodstream. So this galt, like it needs a very good mineral called phosphorus. So this phosphorus is going to have a reinforcing effect over the galt so that the galt can have a very good barrier effect. Okay, so this is about the phosphorus. So whenever like we think about phosphorus, is going to be the galt barrier. Okay, again like a galt, phosphorus rich food could be our fish like tuna, then we have our pork, then we have our tofu paneer, then we have our chicken breast and lentils. So these are the resource of phosphorus. Again, like the so amount of phosphorus which we need in our regular life is going to be very low. The required daily allowance is going to be really very low for both selenium and phosphorus. Okay, so this is about the galt barrier. Okay, so take home points. So like instead of myself telling the take home points, can anyone tell the take home points? The micronutrient. Can anyone tell what are the various take home points which we got through today's session? So we have like two type of cell called cell mediated immune response, and we have the humoral immune response, and we have something called oxidative damage. Against oxidative damage, like the free radicals is going to cause damage, and those free radicals,
Antioxidants.
very good, antioxidant effect. The first thing about the vitamin and mineral, they are going to have an antioxidant effect. Very good. Number one. Number two, so it is going to help in differentiation of T cell. So it is going to help in regulation of T cell, and it is also going to have an effect over the maturation, and it's going to have an function towards species specific antibody response, and there is going to be something called class switchover. So these are the various activity that can be produced by the vitamin or modulated by the vitamin. So majority of the time it is going to be a modulatory effect. Okay, so most of the time these vitamins are going to have a modulatory effect towards our cell mediated and humoral. Moreover, like it is going to act mainly on cell mediated immune response, and it's going to have a protective effect against various pathogen. Okay, so this is about today's session. So do you guys have any doubt in today's session?
Sir, I have a doubt, sir.
Yes.
Sir, like initially you told like RBC, neutrophils, and adipocytes they play role in immunity, no, sir?
Yes.
So how adipocytes play role in immunity, sir?
So adipocyte, again, like that particular cell is going to have an regulatory effect. So like almost all the almost all the cell, like we have studied about gall tissue, and we have something called malt. So similar to the
Okay.
galt or malt, like we have something called as adipocyte. Again, those adipocyte is going to have a role in the lipid metabolism. So it is the particular immune cell which is going to have an conversion effect. So we all know like there is something called LDL, we like low density lipoprotein and very low density lipoprotein, and we have something called
HDL.
HDL.
Yes.
Yes, so those
Yes, sir.
immune cell will be helpful in regulating the transport of fatty molecule.
Okay. Okay, sir.
Sir, I have
Anyone?
a doubt, sir.
Yes.
Sir, um, while talking about the vitamins, you have said intake of many fruits, sir. Nowadays, fruits were many hybrid fruits are there, sir. Is there any side effects while taking hybrid fruits instead of
Yeah,
natural growing fruits, sir?
hybrid fruit, like definitely they can produce certain complication. So they can contain some chemical, but the amount of vitamin, like they don't differ. The amount of vitamin can get altered, but it will not go down beyond the particular level. So at least adequate level will be there in the vitamin. But the main thing is about the other chemical that can cause damage to our human body.
Okay, sir. Thank you.
Sir, one more doubt, sir.
Yes.
Sir, like eosinophils are, you said, sir, like increased eosinophils in parasitic infection. And
Yes.
if we develop any allergy in our body like eosinophilia, that time also our eosinophil counts are raised, no, sir. So how
Yes,
do we
madam.
differentiate whether that eosinophil count is raised due to parasitic infection or due to allergic reaction?
Okay, so whenever like we are going to have an increased amount of immunoglobulin E, like we go for IgE estimation, like we do something called nephrometry, where we will be detecting the amount of antibody. And with this, like we can go for something called radio allergosorbent immunoassay, where we can detect immunoglobulin E specific to the allergen and antigens. So that will give us a clue, like against which allergen that particular IgE has formed.
Okay, sir. Okay. Thank you, sir.
And I wanted to thank like the participants, like around like nearly 150 participants have participated in the session, and I hope like today's session is very useful for you. And like we need a
Yes,
very
sir. It
good.
is very useful, sir,
Okay, so
and
whenever like
informative
we are
too, sir.
okay, so whenever like we are going to deal with immunity, like vitamin and mineral plays a major role. So we have that micro and macronutrient. Even like macronutrients has some role, but micronutrient has have a very good role in preventing various kind of infections. So
Yes.
during COVID, like
Sir,
we were
last
sitting in the
doubt, sir.
yes,
Is there
yes,
any
please.
connections between our normal gut microflora and this macro and micronutrients, sir? Is there
Okay,
any
like
relationship between them, sir?
yes, there are certain microbe which can produce vitamins. So vitamin B6 and B12, certain microbe can produce. So we are going to ingest lot of food which is rich in fiber. So certain organism can convert those fiber into vitamin. So again, like they are going to have a beneficial role by making vitamin for us, and our intestine will absorb those vitamin.
Thank you, sir.
Thank you, sir, for very informative talk. Thank you.
Thank you, Dr. Ashok, for giving your valuable time and speaking in today's webinar. I, on behalf of the whole Skyberg team, really appreciate and thank you for your today's session. And also, we would like to attend more of such webinars by you in future.
Definitely,
Thank
madam.
you.
So I wanted to thank Debashri Rai madam for calling me as a speaker for today's session, and like we will do more sessions, madam. Like we'll do more sessions towards various kind of infectious diseases. So can anyone tell like any infection like which I can talk next time?
Sir, MTB, sir.
Okay, so you want to learn about MTB? Okay, any other
Yes,
infection?
sir.
Okay,
You
MTB
have
is
said like you are mostly exposing towards MTB, sir. So
yeah.
you may
Okay,
know much about MTB, sir. So we want a session about MTB, sir.
okay, definitely. So we will do a next session
Thank
on
you.
mycobacterial tuberculosis.